Welcome to Session 7 of the Diabetic Foot Manual series, where we'll learn how to care for your wound safely at home. Once your doctor has assessed the wound and sent you home, the daily routine becomes your job. And doing it correctly is what protects the foot. The home dressing routine has 4 steps: dry, observe, cover, and seal. And only if your doctor has instructed a change. First, you dry. Pat the wound with gauze and never leave moisture between the toes where skin softens and breaks down. Then, you observe by pressing gently toward the wound and cover it with clean, dry gauze. Not too large, not too thick. Basic healing has a name for each of these steps, and the reason behind each one matters more than the order. Drying prevents maceration. That's when skin softens and falls apart from staying wet, which is why the area between the fingers and toes must always be checked. Cover and seal are the last 2 steps, and this is where most people make mistakes at home. Use hypoallergenic paper tape on the edges like a frame, leaving the center free, and never elastic bandages, because they cut off circulation to a foot that already struggles with blood flow. Your doctor may choose one of 2 ways to treat the wound. Traditional healing keeps the wound dry with gauze and topical agents, the most common approach used at home. Advanced healing uses a moist environment with modern dressings, hydrofiber, foam, hydrogels that can speed healing, but only your doctor decides which is right. So how does a wound actually close? It happens in 3 phases. Inflammation first. The leukocyte defends the wound, which is why redness and swelling in the early days are normal, not a sign that something is wrong. Here are those same 3 phases in plain words. Rebuild is next. New pink tissue fills the wound from the bottom upward, and this is a good sign, even though it looks different day to day. Then new skin grows in from the edges until the wound is closed. A changing appearance is part of healing, not always a setback. There's one principle that ties all of this together. Time is tissue. Debriding means removing dead or infected tissue. And the longer you wait to do it, the more skin, fat, muscle, or even bone is lost. So never delay going to the medical center. Coming up next in Session 8, insulin. Quick, barely painful, and one of the things that helps your wounds heal. This session was brought to you by Alianza para el Salvatare del Pie Diabetico in Peru with WoundScribe and Pingu, your AI health companion.